Hi guys, we're going to start today talking about the different injuries associated with the hip pelvis and the thigh. Okay. Our first injury is the quadriceps contusion. Okay. Refresher, remember a contusion is a bruise. Okay. Quadriceps contusions are pretty common, especially in contact sports like soccer, football, when you have people that are constantly hitting one another. Okay. We can also see this sometimes in baseball and softball when they get hit by a ball. Our mechanism of injury is going to be a traumatic blow, okay, just like any other bruise, okay. The muscles around that make up the quadriceps are usually pretty strong, so sometimes it can be pretty uncomfortable, kind of have, people say that dead leg kind of feel. But usually the muscles are strong enough that it doesn't quite get as hard down to the femur, which is a plus because the direct blow could fracture if it was in a weaker area. Our signs and symptoms are going to be similar just to any other kind of bruise, okay, or any other contusion. Pain and muscle weakness, okay. That temporary loss of function, that's kind of where people talk about that dead leg kind of feeling, okay. A limp could be noticed, especially if it's big enough and that bruise is covering more surface area. But remember that any bruise can vary between it being more superficial and deep. Okay, obviously the deeper the bruise is, the more of these symptoms that they're going to have. Our treatment, something that's really important with our quadriceps contusion, is that when we do our compression wrap, because we want to do the compression wrap to push the swelling, you want to do it with the knee flexed, and I'll show you what that looks like in a second. It just helps with our healing process, okay? Obviously, our price method is always going to be great, okay? No heat. We don't want heat in the first 72 hours, just like with any injury where we have this increase in blood flow, okay? So here's what I mean right here by having the ice wrapped on and the compression wrap while the patient has their knee in flexion, okay? This is showing you right here just the changes in the bruise, this as it's starting to heal, okay? Very common. I'm sure some of you have had these yourselves. It's one of those things, though, especially with our quadriceps, if we don't take care of it, it can lead to some other problems, and we definitely don't want that to happen. Our next condition is myositis ossificans. Okay, big words there. Remember, anytime we see the word or the ending itis, that's talking about inflammation. Okay, myositis ossificans relates to quadriceps contusions. Okay, you get a severe blow, okay, or you can get it repeatedly, kind of in the same area. And if you don't take care of a quadriceps contusion, we get this bone development in the middle of your muscle, okay? Your body's going to do whatever it possibly can to protect itself. So if I keep getting hit in the same spot, my body is going to start to send the calcium to that muscle to try to protect itself. It's tired of getting hit. And we need our muscles to be a little elastic because they're constantly contracting and relaxing. If we put a hard piece of calcium in the middle of our nice rubber band muscles, we're going to have a problem somewhere, okay? Those muscles are going to stop being allowed to move quite so efficiently between contracting and relaxing, and that's going to cause a problem with that function of that muscle, okay? Our signs and symptoms, okay, obviously we've had that direct blow, so we have some contusion signs and symptoms, the swelling, the discomfort, that kind of stuff. We're in that acute inflammatory stage, but the big thing here is in 2 to 4 weeks, it's not better, you have that bone formation showing up on your x-ray, and I'll show you what that looks like on the next slide. Usually a bruise is going to go away in the 2 to 4 weeks, okay? If that area keeps getting hit and it's not healing and there's a re-injury, this is where this stems from, okay? What we're going to do about this? conservative treatment. Okay, trying to get that area to heal, so protecting it, stop having that, allowing that area to get hit. There's some ultrasound that we can do to help break things up. If that is, none of those methods are helping, they actually have to go in and remove that piece of calcium, which is surgery. Okay. You're showing an x-ray right here. This is the knee. Okay, there's our little patella. Okay. Right here is the development of the calcium in that calf muscle. Okay. So you can see the extra white part on the x-ray. All right. Here's showing you the hip and the femur. All right. And here's along our quadriceps right here. You can see the little extra white, kind of milky looking substance. That's that calcium building up. We don't want this to continue. Our next injury is the quadriceps muscle strain. So we're dealing with the muscle and the tendon here because we know it's a strain, not a sprain. Okay. Most of the time, especially when we're talking hip and pelvis, we're going to see this in our rectus femoris muscle because it's the main one that's going to be working at our hip and our knee at the same time. Well, we talked about in our videos before this that it's doing two jobs. It is working to extend my knee, but it's also at the same time working to flex my hip. So it's kind of being pulled in two different directions, okay? And it's a big, strong muscle, but it kind of has its breaking point, okay? So when it is being stretched too far or with too much force, that's when we get these muscle strains. So we start to have those little tears in our muscle fibers. Signs and symptoms, keep in mind that this can be grade 1, 2, 3, okay? So there's going to be a big varying difference between just a little bit of pain and I felt a pop, I am having trouble walking. We see point tenderness where it is actually tender to touch, all right, that area because of the torn fibers themselves. Muscle spasm is a big one here. Your body contracts the muscles around an injury to try to protect itself from further injury. So when we're dealing with such a large muscle group, when one muscle is injured, the other ones around it are trying to protect it. So that does give you kind of a muscle spasm where everything locks up and clearly it makes it a lot harder to walk. And we will have some bruising and swelling most likely. Our treatment, our good old rice method, okay? We see a lot of people that feel comfortable having compression, especially as they start getting active again. So compression wrap, we have black little neoprene sleeves. Usually it just helps kind of with the comfort. So here is our rectus femoris right here. We've got our quadriceps strain. Remember, that can be anywhere along this muscle. That can be from just a itty bitty few fibers to a whole across rupture, okay? This is what our little rectus femoris rupture would look like over here, okay? So big varying, it can be any one of those muscles, but most of the time we're going to have the rectus femoris involved, okay? But keep in mind, varying in severity. On the opposite side of that, we have the hamstring muscle strain, so dealing with the posterior side. Our hamstrings have a really greater chance of injury just because they are not usually as strong as our quadriceps in front. And remember, in our body, we have opposites. So if the front side is really, really strong, you need the back part to be strong too to help kind of compensate, to help balance each other out. And when they're not, this is where we have a higher chance of this happening. So we usually get our hamstring muscle strains, okay, when you have a quick change from your going from flexion and extension, okay. When your hip is in extension, these hamstring muscles are activated, okay. So we in a little fun fact, okay, in most athletes, the hamstring muscle group should have at least 60 to 75% of the strength of the quadriceps, okay. Well, we would like it to match up, but that's kind of not how it works, okay. If you look at a person, they're usually got a lot more muscles on the front of their legs than they do on the back of their legs. It's kind of just the way our body works. but we need them to be pretty close to the same strength, or this is where these problems occur. So strains can involve the muscle belly itself, where those muscle fibers are, or a lot of times it's where the muscle turns into the tendon. Okay, and we're gonna see that in a second. Our signs and symptoms, you're gonna have a lot that are similar to the quadriceps strain because you're dealing with the same type of tissue. We're just dealing with a different muscle group. But this can all vary depending on how severe it is. One thing that we didn't talk about in our quadriceps is the muscle defect. If you've torn enough fibers, you can actually take your hands and feel a divot in the muscles. And that's because those fibers are torn, that instead of them being nice and plump, they're kind of like caved in like a hole, okay? And in our hamstring muscle groups, since they are usually a little bit closer to the surface, you can actually feel that. Definitely not a good sign. It means it's definitely a little bit more of the severe injury than a grade 1. Our treatment's going to be the same as our quadriceps strain, our RICE method. Definitely emphasize the rest on that. And that compression wrap will always help. So here we've shown two different injuries here. They're both dealing with the hamstring, but they're very different. Right here is where we have the tear where the hamstring is attached to that ischial tuberosity. Well, if you have completely torn off that muscle, it is not going to contract the way it should because there's nothing for it to pull on. Okay, definitely a problem here. And here we see a tear where the hamstring tendon is, the hamstring muscle is turning into the tendon. We see this a lot, all right? This is a whole lot more common than this, but both are a big deal, okay? Both need to be properly taken care of to make sure that this doesn't happen again. Our next one is going to be the acute femoral fracture, okay? Before we get into this, remember, acute is a new injury, okay? You didn't just wake up. You didn't develop it over time. Something happened immediately, all right? And keep in mind, the femur is the longest and strongest bone in our body. So it is going to take a lot of force for there to be a femur fracture. We do see this in athletics. Thankfully, not a lot, okay? But it is going to be a medical emergency. So our mechanism of injury, most of the time this is going to occur in that mid-shaft, okay, because we know it's weaker there than it is at the ends where the epiphysis is, okay. Signs and symptoms. With this fracture, it can vary from where it is displaced or it's just cracked across. Neither is going to be a good situation, but if this is a displaced fracture, much less an open fracture where it is popping through the skin, is going to create a lot of additional problems, okay? With this, we see shock a lot. Our patients start going into shock. This is extremely painful. You've literally just broken one of the strongest bones in your body, okay? Muscle spasm is a big one. We talked in a couple chapters ago about that traction splint where it pulls the bones back down so they match up because our muscles are so strong that when this happens and everything spasms to help protect it, it actually causes those bones to slide over top of itself. Well, that is not going to be a good situation. You are going to activate EMS and splint immediately. Okay, this picture is going to be a little nasty, so I'm sorry. Here's showing you our fracture right here. This is clearly an open fracture where it has poked through the skin. Anytime we have those kind of fractures, okay, medical emergency, call 911, all right? We're going to pick up in our next video with the rest of them, okay? I will see you soon.